Hello, my name's Kath. I'm an international student advisor, and today I'm going to talk to you about healthcare in the UK and how you access that. The first things first, you perhaps just arrived in the UK and it's all very exciting, but it's all very new. And the most important thing for you to be doing is to make sure you're taking care of yourself. Many things will be different, the weather, the food, the culture, all those kind of things. So it's important to make sure you're eating well and just taking care of yourself. And that includes knowing how to, should you ever need to, access the healthcare systems that the UK offer. So the National Health Service, or the NHS, as you'll often hear it referred to, is the UK healthcare system. It's a system that's mostly funded through our government and through our taxes. Some NHS services are free. In fact, a lot of them are free, but there are some that require payment. As you can see on the screen here, there's a list of the treatments that is free for absolutely everyone. So that would be accident and emergency services, family planning, and diagnosis and treatment of sexually transmitted infections. So the main way to access the NHS would be through your local doctor or GP, which is general practitioner, but you will often hear it referred to as GP. So the nearest doctors to University of Plymouth campus is the University Medical Centre, which is right on the main campus. And we recommend all students register with that doctors as soon as they can, as soon as they're able to register. You don't have to register with the medical centre on campus if you don't want to. If there's one that you prefer nearer to where you live, then you're absolutely welcome to register with that one instead. When you do register, most practices will ask to see some ID, often a passport and a BRP card, so they can assess your eligibility for NHS services. Not all will ask, it depends from practice to practice, but you will need to register whichever one you choose to go with. And that can be done online in some cases, and it can be done in person in other cases. So it's best to check with whoever you wish to register with how they want you to do that. Mostly just have a look online. There'll be information about how you register once you get on there. And the University Medical Centre, really, they largely only deal with students, so they will have absolutely the right information to help you. So who to contact? So if the worst happens and you don't feel very well, it's important that you know how you get help if you need it. So in an absolute emergency, the number to ring would be 999. So that is the number that would send for an ambulance. Now this number isn't to be called anything, it is just for emergency incidences. So that would mean something like severe bleeding or chest pains. It's not if you just feel a little bit under the weather. So there are other options for other types of ailments, should we say. So if you need help fast, you're not feeling very well, you perhaps have an urgent medical problem, but you're not sure what to do, that's when you would call the number 111. So it's not a life-threatening situation, but you really don't feel very good. And in that situation, they'll tell you whether it's best to go to a hospital, to go to an emergency centre. They'll tell you what to do. The other type, probably the most common one, would be to call your doctor or your GP, and they will book you an appointment to go in and meet with someone. So that's what happens at the doctors. They very often will require you to ring up or email them, and then they'll assign you an appointment. Sometimes they have appointments over the phone, but your GP acts as your main point of contact for your healthcare. So they would be sort of for routine appointments. They also do urgent appointments, so if you contact them perhaps in the morning, they might assign you an appointment later in the day if it's urgent. And then we have pharmacies. So you will find in shopping centres and on high streets, and they can help with minor ailments like coughs and colds. So the kind of NHS services you can access might vary on your immigration status in the UK. So if you have a Tier 4 visa and you're on a course of 6 months or more, you would have paid that immigration health surcharge, or the IHS charge, you probably remember. And it entitles you to access the NHS care in the UK at no additional cost, in the same way as a permanent UK resident would be able to. So you can have free doctor's appointments and free hospital treatment. If you're from the EU or the EEA, then you should make sure before you travel that you get your European Health Insurance Card, or EHIC card, like the image on the screen there. This will give you access to the NHS. Although this may be changing in January, when the transition period of leaving the EU ends, I recommend you have it for the first period where you're here, and we will be notifying students what all the changes mean as it becomes clearer and as we get closer to the move across to leaving the EU and the end of the transition period. If you're on a short course of less than 6 months and you're not from the EU, then you probably have a short-term study visa or perhaps a short Tier 4 visa. In that case, you are not eligible for free NHS treatment unless it's one of those emergency ones or those ones I mentioned in that first slide. We strongly recommend you take out private medical insurance for your stay while you're here. And if you have a doctor's appointment, you're likely to be charged. So it's definitely worth making sure you're aware of that. It doesn't mean you shouldn't go. If you are ill and you need to see a doctor, you should always go and seek help. But just be aware there may be some charges, so having that insurance would be valuable for you. There is a range of services that have to be paid for. So that is regardless of whether you're entitled to NHS treatment or not, you have to pay for these. So that will be prescription, so that's any medicines or regular support you need, mostly in the form of drugs. Dental treatment, so any dentist that you see, that would be chargeable. There are NHS dentists and there are private dentists, so you'd have to look into which one you want to use. Sometimes if you go for an NHS dentist, you have to join a waiting list for a little while before you will be assigned one. But either way, you have to pay for that, as do you have to pay for opticians and eye care. That all requires a payment. So coronavirus, the big issue at the moment. Hopefully no one will get it, but if that does happen to you while you're in the UK and you think yourself or one of your students, one of your friends, anyone you know perhaps has it, then it's really important that you follow correct procedures. These procedures are perhaps changing a little bit at the moment, so I'm not going to list exactly what you should do. I'm going to ask you to check on that web page that's just there on the screen to make sure you're following the latest advice. It might be that you need to self-isolate, it might be that your housemates need to self-isolate, it might be that you need to book to have a test to see if you definitely have the virus. If it does happen and that you test positive for the virus, then you would need to let Student Services know that that's happened. Also, if you're self-isolating for a couple of weeks, if that's required of you, it's best to let the university know, just so we can keep everyone up to date about what's happening with you. But yeah, we would like to know if anyone's really poorly. It's important that you let us know. So I appreciate there's a lot of information here about accessing the NHS as well as who's entitled. So if you want to read up on this yourself or you want some more information, here are some great links to where you find that kind of information. So there's the NHS web pages yourself, the UK Council for International Student Affairs, or UKCISA, their web page has an incredible amount of stuff which is just meant for international students. It makes it really easy to digest. So I would always recommend having a look on their web pages. and also the University Medical Centre, 100% designed for university students. They will be able to help you if you have questions as well. So separate from the NHS services, so they're all available, but the university offers a range of mental health or wellbeing support to help make sure that students aren't struggling while they're doing their studies. This is something in the UK that's talked about, that you will hear over and over again about mental health and wellbeing, and it's something we really want to make sure students are aware of. So if you have any questions or any concerns, or you just want to chat to someone, then our mental health teams, that's the way to go. They will absolutely help you out. You can find out more online on that link there, or you can email our student services team, or you can call us. There is always someone around to help. So if you do have any questions, this is how you get hold of us. So it's our email address there and our phone number, and we'll help in any way we can. Sometimes it might be that we then refer you on directly to the NHS or to somebody who can answer your questions in more detail, but don't worry about that. Any questions, just come to us and ask, and we'll see if we can find the answer for you. So thank you very much. Thank you for listening, and any questions, we'll see you in the hub.